Namaskara. I am Dr. P. Harihara Murthy. I am a practicing ENT specialist in Bangalore for more than 3 decades now. Tonsils, along with adenoids and the lingual tonsils, form a circular area of protection for a child in the initial period of its growth, and they are active between 2 and 4 years of age. So a slight increase in size is corresponding to the activity of this protective ring at the level of the nasopharynx and the throat to protect the child from inhaled or ingested infections. So infections going through this route will get neutralized in this lymphatic tissue in the nose and the throat. Sometimes this tends to increase in size, thereby causing respiratory embarrassment, difficulty in swallowing, pain in swallowing, recurring infections, etc. When the child is having respiratory embarrassment and having inability to sleep well at night, it absolutely means the child is going to have a progressively decreasing immune system, which is possible when there is poor sleep. Sleep is an important factor in the building of the child's immunity. So that is something that is an absolute indication for removal of adenoids. The twin of the adenoids in the throat is the tonsils. The two tonsils in the throat tend to sometimes increase in size, be large enough to cause difficulty in swallowing and in breathing, causing recurring snoring at night, as a result of which child has also disturbed sleep. The inability to breathe freely causes the child to lose sleep again. So these are the indications where a tonsil will require removal. Not always do tonsils require removal. Any child above the age of 4 to 5 years having more than 3 episodes of infections in the tonsils and has difficulty in swallowing, recurring fevers, increased size of the associated glands in the neck, etc., would be the cause for removing a tonsil. After 4 years of age, since they do not participate in the immune building capacity in the child's body, their presence is not really contributing to the immunity and can be removed if there is an absolute indication for removal of the tonsils. Not all tonsils require removal, and only a child who is having recurring problems in its growth, recurring infections, or is having poor sleep and is not able to swallow will require it to be removed.